Ladies and gentlemen, are we fighting war? Director General of NCDC was on our seat recently at National Assembly. Several allegations, counter-allegation, and response. I would love to refresh your memory for you to know what is going on. Are we in war? Are we fighting war at this moment? Is it good to make law on current situation? Should we wait till the end of the situation or at the moment? Your opinion will be the best. Subscribe to this channel. Join me as we listen to both speaker and the DG. Thank you.
Thank you, DG. You're welcome. Has he just come in? Okay, Dr. Mamora is here. You're welcome, Dr. Mamora. Okay, DG NCDC. I want to read NCDC, sorry, I keep mixing it up. You've done a good job and we commend you. But you are reported to have made certain statements that have gone all over. And many people have latched onto your statement about the middle of a crisis not being a good time to amend a law. You also purported to have said that no one consulted you. And I'd like some clarification on those two statements. In making that clarification, or in asking that question, I want to read what we have all just heard from the leader of the Presidential Task Force and the Secretary to the Government. Paragraph 18, the SGF states, just as important is the need to provide a strengthened legislative framework for dealing with future public health emergencies in a changing world. The current Quarantine Act needs to be updated due to the unique nature of emerging infections such as COVID-19. The dramatic impact this has on sectors beyond just health, and the urgency required to deal with such pandemic. That's from your team, and that's paragraph 18. Paragraph 20. Mr. Speaker, as I mentioned when the combined leadership of the National Assembly was briefed on 9th April 2020, our nation is at war against a very dangerous, unseen, and ubiquitous enemy. And all hands must be on deck to successfully prosecute the war. In addition to providing the kind of leadership already demonstrated, the National Assembly finds itself in the unique position to do the following, though not exhaustive. 1, develop a legislative framework to prepare Nigeria for any future pandemic. 2, develop a legislative framework for reforming and transforming our healthcare system. DG, I would like to know how you stack that up against your now famous position that this is not the time to amend the Quarantine Act. In answering that, because it is of concern to all of us, because we must listen to and hang on to your everyday word. because you are the expert. You also stated that the House did not consult you. I'm not going to ask the question, I'm just going to put it out there. That it is not at the stage we took that bill that we consult stakeholders. It's not done. Stakeholders are consulted at the stage of public hearing or at the committee level, not before, not at first or second reading. So the question for me is, DG, have you had people escaping the isolation centers? Have you had situations where somebody escapes an isolation center? And I believe you have. We've had reported cases of people escaping the isolation center. How does the current law deal with somebody who escapes an isolation center today? How does the current law deal with somebody who escapes an isolation center and has the potential of infecting, even in one hour, hundreds of people? Second, is the current virus, the COVID-19, is it covered by the Quarantine Act? Because from my belief, it is not. So those are the questions I want you to answer, and also whether airports from which this virus came is covered under the current Quarantine Act. So, honorable colleagues, those are the questions, and I don't know if some colleagues have further questions before we go back to... No, there's no presentation.
Right Honorable Speaker of Nigeria's House of Representatives, Your Excellency the Deputy Speaker, principal officers of this esteemed House, honorable members of the House of Representatives, members of the Presidential Task Force, the chairman of the House Committee on Health, who I speak with almost every day. It's a privilege to appear before you, Mr. Speaker, for the first time in 2 months. Mr. Speaker, there could not be a bigger champion of a change in our legislative framework to fight infectious diseases than myself. In my position as the Director General of the newly established Nigeria Center for Disease Control, we are the most affected by the deficiencies of the laws as they stand at the moment in our fight against infectious diseases. Mr. Speaker, in answer to your 2 specific questions, these questions were thrown to me in the context of a television interview on the same morning that I had seen the bill for the first time. You're absolutely right in saying that the point for consultation had not reached. But I was answering to a specific question by the journalist at the time. Had I been consulted? The only honest answer to give at the time was that I hadn't been, because I hadn't been. So I really look forward to having the opportunity to working with your House in refining this bill. The responsibilities of the Nigeria Center for Disease Control are actually very specific. There are many other stakeholders that have wide-reaching responsibilities at the federal, at the state level, at the local government level, in protecting us from the threat of infectious diseases. So, Mr. Speaker, without going into the details of what was said or not in the public space, I'd like to assure yourself and all the members, and I think I speak for the Presidential Task Force, my Honorable Minister, and every member of our team, that we look forward to a new infectious disease bill, in fact, a new public health bill that brings together the functions of all the agencies, defines responsibility, and leads us to a position where we can really be in a stronger position to protect the health of Nigerians in our Federal Republic. Mr. Speaker, I am sorry if these comments caused any offense, but you could not have a stronger ally. You could not have a stronger ally in the review of our legislative framework to the fight against infectious disease in our country. Thank you, sir.
Thank you. When do you think we should do that? After the crisis?
The Right Honourable Speaker, it's not a question that I can answer. Right now, I am working on your behalf and on behalf of all Nigerians. There are many of us on the front lines. We work 18 hours every day, non-stop, Sunday, Saturday. We have not stopped for 3 months, sir. We will not stop. My promise is that we will keep at this. This is a marathon, it's not a sprint, and we will assure all members of the House here, together with the leadership that meet every day to assess and provide us guidance, that we are in this fight for the long term. Thank you, sir.
Honourable members, should I let the question go and we move on, or do I have a follow-up question? So your answer to my question is it can be done in the middle of a crisis, yes or no? In fact, I put it to you that the best time to amend a bill is in the middle of a crisis. So, yes or no?
Mr. Speaker, it's not in my position to provide an answer. I think you're right in your process. Mine is to do